guys, let's start our today's podcast session with Dr. Tuli. And so to enlighten you about tuberculosis in bones, let's start our first patient. So, sir, tuberculosis in bones and tuberculosis, are they both different or like same?
Tuberculosis in the body almost behaves like same, whether it is in the lungs or in the kidney or in the bones. The commonest location of tuberculosis in the human beings are the lungs. Why in the lungs? Because it's an airborne disease. The man gets the infection through the air. Somebody is breathing tuberculosis bacilli outside his body through the breath, and that breath is swollen by somebody else. It goes into the lungs, and the lung TB most common. Bone and joint tuberculosis is not that common, but one should know it. Tuberculosis can occur in any part of the body. Commonest, lungs. Next to it, viscera. Next to it, kidney, intestines. Rarely, brain, meninges. And roughly 3% of all tuberculosis in the world occurs in bones and joints. This is what it is. The treatment remains the same, the behavior of the patient and the people around remain the same.
मतलब कि जो normal tuberculosis लोगों को होता है and tuberculosis in bones, दोनों similar ही है.
The Kitanu is the same. Kitanu is the same. And basically, treatment also remains the same. But certain care are to be taken. If there is a bone disease, some care has to be taken. If a patient has only lung disease, you don't require any special instrument or a special shoe for the person. But if bones and joints are involved, you have to give a special shoe or a special belt. Basically, the same Kitanu, same medicine will cure the patient.
Okay, sir. So, what are the symptoms of tuberculosis in bones?
Yeah. And first of all, we should all know that roughly 1 million people die of tuberculosis every year in the whole world. Roughly 1 million people die caused by TB, 1 million in 1 year. The earliest symptoms are evening rise of temperature, loss of appetite, you start feeling weak, lassitude. You feel weak mostly in the afternoons. Even small amount of work you have done in the morning, you feel exhausted in the afternoon. So, low-grade fever, loss of appetite, loss of weight, and we use the word lassitude, which basically means that you feel very weak, physically, mentally you feel very weak, mostly in the afternoon. These are the broad symptoms of active tuberculosis. And when we treat, these are the symptoms on which we keep on looking. Has the patient reduced the fever, improved the appetite, has started feeling better, the weight loss which had occurred in the active disease, has that weight loss been recovered? So all these are clinical features to judge whether the healing is taking place or not.